The medical strain caused by musculoskeletal diseases is increasing rapidly as the population ages. If a patient requires a major orthopedic intervention, procedures are complex, outcomes are uncertain, and there is a high risk of complications. The TLEMsafe project aims to find a solution by creating a patient-specific surgical navigation system. This patient has a tumour in the thigh near the knee. Of course, the main objective is to completely and safely remove the tumour. However, will enough muscle strength remain for daily activities such as walking? In order to improve mobility, perhaps a muscle that bends the knee can be transferred to extend it. To find out, the first step is to do an MRI scan of the lower body. This scan contains the detailed anatomy of the patient and shows how the tumour is embedded in the thigh. Using innovative software, the shapes and positions of bones and muscles are identified. Based on the MRI scan, a computer model is then made that recreates the patient's specific anatomy. To assist in planning the surgery, the surgeon uses the TLEMsafe pre-planning system to simulate several surgical options using the computer model and to predict their functional effects. Then the surgeon and biomedical engineer discuss the simulation results. If only the muscle tissue around the tumour is removed, normal walking will be impossible, whereas if a muscle is transferred, to compensate for the muscle loss from the tumour removal, a closer to normal walking pattern can be achieved. The doctor shows the patient the MRI scan and the results of the computer simulations. She explains that the plan is to insert a knee prosthesis implant and to perform a muscle transfer in order to obtain the best functional result after the operation. The surgery is performed as was previously planned in the computer model. The tumour is removed, the prosthesis is placed, and the muscle transfer is carried out. Concluding the successful surgery, the wound is closed. Shortly after the surgery, the surgeon explains that the operation went according to plan and the knee prosthesis implant was inserted successfully. The muscle transfer should help the patient to recover rather quickly. After this extensive surgery, the patient needs to learn to walk again with the help of a physical therapist. The rehabilitation plan is drawn up based on the computer predictions. This enables the physical therapist to know exactly which muscles need to be trained. Several months later, rehabilitation is almost finished, and the patient will soon be able to walk without crutches. TLEMsafe aims to improve the safety and function outcome of orthopedic surgery and provides a user-friendly training facility for surgeons. This project is a European collaboration between 6 partners and is funded by the European Commission.